We're talking about COVID-19. We have, kids at home doing distance learning, and now we have wildfires. And this is a lot of stress, and it could cause anxiety for adults. But when we're talking about kids, what kind of impact does it have on them?
Well, we have to realize that these kids have already had a lot of chronic stress. They've been sheltering in place, they've been missing their friends, they haven't had the normal socialization that they're used to. So we're already putting another layer of stress on families and kids. So we really need to think about what can help mitigate some of that stress. And parents need to have some strategies so they feel confident in how to manage their own stress, but also their children's stress. So I think
Yeah, and
some
that gets a
strategy.
little tough. So what can parents do to communicate with their kids to help in that?
So every family is going through something different in response to the pandemic and now the fires. So many families are having the acute stress of having to evacuate or worrying about their lives or worrying about their homes. So they have a different level of almost a trauma experience. Whereas other people in our community are not necessarily directly impacted, but that added layer of stress does get our fight or flight system activated, which means that we need to have strategies to calm our bodies and feel a sense of being safe. So parents they need to talk openly with their children about what's happening. It's very important for them to emphasize that they're safe. So safety is something that's one of the very backgrounds. It's one of the things that has to be felt in place for us to be able to calm and relax. So if we think about that fight or flight system, it makes our body really activated, our heart palpitations. That's really when we have to escape. But once we're safe, we need to be able to take control of that autonomic nervous system by being able to be calm. So when parents can model being calm, talking through what's happening, and looking at what's going right, being safe, that can be helpful. As hard as it is,
What
if you're,
about
I was going to say, as hard as it is if someone's displaced, one of the things that's very helpful for children and families is to have some regulation of routine. So that means trying to have regular meal times or trying to have regular bedtimes, having something that they can count on that's more automated so they can know what to expect.
What about talking, watching what you say in front of your kids as well? Because I feel like I have to be conscious of that. I have 3 kids at home, and, I come across information all day long. That's part of my job. But you really have to kind of edit what you say in front of them as well, right?
Absolutely. I think that it's really critical for children to have minimal exposure to media. Seeing the wildfires or looking at an article if they're school aged can re-trigger the fear response. I think that adults do have to, understand what's happening. They have to do contingency planning. To the degree that they can do that, not directly with the children listening, is a protective layer.
And this can definitely cause a lot of anxiety. What about leading to behavior that continues, maybe temporary behavior?
So children at different developmental levels have different responses to stress. So when we see like a preschool or young child, they may in the moment become more clingy. They need more physical comfort, and they may have regressive behaviors like having potty accidents or they need to thumb suck. Um, we want to try to mitigate their stress so that this is something that's temporary during the acute incident. With school age children, a lot of them may even have sleeping problems or not be interested in eating, so their regulation can be off. They can also have a range of externalizing behaviors, such as acting out or having internalizing behaviors like crying excessively and worrying. So it's very important for kids that have the language and processing abilities to be able to talk about what's happening and to know what to expect. With high school age kids, they also may have a sense that they need to do something and feel that they're out of control because they don't have anything concrete that they can do to control the situation. we know whenever we feel out of control, that exacerbates anxiety. So we can really focus on what can we do? Can we help with some of the people that need supplies? Can we do signs to say thank you to the firefighters and first responders? We can always think about what's something that we can do that helps control feeling a sense of power.
Talk about the effect that this can have on a young person when they're already kind of stuck inside anyway because of the pandemic, and then now even more so because of the air quality. If their homes aren't being threatened, their lungs can be, and so that's limiting a lot of parents from letting their kids even go out to the backyard and play.
It's really stressful. We know that exercise is a wonderful way to kind of get rid of some of that steam and the anxiety. I think that lots of families have found different ways to play hide and seek in the house, or, do a scavenger hunt, or do some online exercise. Being playful and having some alternative strategy can help also with the mood and have something positive and joyful that they can do, even when it's this extremely stressful time.
What else should parents know, or even teachers, when it comes to talking to young people about everything that's going on? There's a lot.
There's a lot going on. I think that what we know is that it's important to talk. It's important to encourage children to express their worries, their fears. Some of their worries may or may not be reality based. So it's important for parents to know what really children are concerned about. What we do know is that one protective factor is staying connected in meaningful relationships. So we really can, in this time of COVID, use social media, Google Meets, all these different platforms that kids now are experts at using to be able to stay connected to their friends. So that's something they can look forward to, and it does decrease their sense of isolation. Also, I think it's very important to try to really keep and build a routine. Then kids know, okay, I know what happens after breakfast. I know what happens after lunch. That helps establish kind of an automated day, which decreases worrying about what's happening next. And then the other things that parents can do is help with mindfulness or gratitude, because that helps our physiological symptoms decrease. Whenever we can take control of our breath, control of our body, and really center in, that does do something physiological to reduce the stress response. And then it's really important for parents to continue to survey whether their kids' behaviors or emotions are at the level where they really should seek mental health supports. Kids do have an increased risk in this time of having true symptoms or of anxiety or depression because it's been a very chronic, stressful time.
Is there a certain age that gets hit the hardest?
I think it's a lot about the circumstances. So I don't think we could say that there's a specific age, but it's the layer of stress. So when we think about the poor families who have lost their homes, and that is a level of trauma that's quite different than a family that has family or a teacher that's been directly impacted. So I think it's the level of direct stress and trauma that impacts the risk for going on to having more toxic stress. That's why we really want to use the strategies to mitigate this acute stress so that it doesn't go on to exacerbate into a clinical symptom.
Anything else you want to add?
I think that there are lots of really good resources that we want to direct families to. The California Surgeon General has a stress relief playbook that's on the website that gives families even a plan that they can put together for how are they going to stay connected with the relationships? How are they going to use strategies to mitigate stress? I would direct families to the Stanford Children's Health website. There are lots of resources. And I think that the more information parents have, the more they feel empowered to really support their own mental health and their children.